Thank you so much, and welcome. Nice to see so many online here. So I'm going to talk a little bit about how I look at the role of AI in mental health promotion, and I'm going to focus more on the applications in working life than the general application. But before I get started with that, I would, as a background, tell a little bit about the place I'm working and what angles we have with mental health and workability. So Ilmarinen is one of the three major pension funds in Finland. We take care of the earnings related the work pensions of more than 1.1 million people. So we have a mandatory pension insurance that each company has to take for their employees, and we are one of the companies handling these insurances. There's a couple of figures. So we're almost 600 people working here. We take care of if you count them together, 130,000 companies, so both companies and single entrepreneurs, and we have about 60 billion euros in pension funds that we manage. However, I don't work with that money, but I help with the work disability risk for client organizations, and this is how some of the areas that we're working. So strategic workability management, occupational rehabilitation, physical factors and ergonomics, occupational health care and best practices there, data and knowledge management, psychosocial factors, and mental health, and those two other ones I focus on mainly. Also, I do a little bit of dabbling in data and knowledge management due to having gotten a degree in computer science as well. So this is what I work with. And then if we go to the need and the uses of AI to promote mental health in workplaces, there are a couple of figures that are often repeated. So this is the statistics from Kela, the government institute for pensions, who also keep statistics of sick leaves and sickness absences, because the companies, the employers, get money from the sick leaves that the employees take. So almost 50,000 persons last year received sick leaves with anxiety-related diagnosis. So we see the main mental health categories that are shown here, and the time series for those. So we have depression. It was on the rise for quite a long time, but that has now a couple of years since broken. But anxiety disorders have increased over double in the last 9 years. Personally, I think one reason for this is that people seek help earlier than they did before. So they start seeking help already when they are feeling anxious, and not when all their energy is spent and they end up with depression. So there's quite a lot of like short-term workability issues related to mental health. But this is the other figure, and this is the disability pensions, and this is now incidence rates. So it's the portion of the workforce that get disability pensions, and if you look at the amount of pensions, it looks a little bit different. But if you look at the incidence rate here, the dark blue one is musculoskeletal disorders, and the light blue one is mental and behavioral disorders. So here we see that the trend is not that much rising at the moment. Again, this is not the whole truth. Applications for disability pensions for mental health reasons, especially from young workers, are on the rise. So there's this kind of phenomenon, but it's too early to say that the incident rates for the pensions are getting out of hand. So this is one of the, I think, more positive news. Okay, so the way I look at it, the use cases for AI in promoting mental health are as follows. One is how we sense, detect, and predict mental health problems. And as I looked at the other speakers' titles for this is something that we are going to hear more about, and this is something that I'm very interested to hear about. Another one is to think about how to support the decisions for choosing an effective intervention. So once we have sensed, predicted, detected that, okay, here's a potential mental health problem, what would be the correct level of support or mode of support for this person? One company in Finland that I'm actually a little bit involved in, called Formulator, does exactly this. So what they are doing is that they have a tool that helps you kind of verbalize and organize the thoughts relating to the problem. So then when you go and see a professional, you have it kind of thought out already. Another quite obvious one, and this is one that there are many applications, carrying out the actual interventions. One of my favorites for this is called Wobot. It's a chatbot that helps you with mental health issues. It also sends occasional cat videos and tells stories about the toaster, who is his or its colleague at the office. So it's kind of fun. It's worth trying out. And then we have the possibility to kind of support interventions, that we have a tool that supports the intervention. And one that I ran into, I think this is from the United States, cheeseburger therapy, in which untrained people give other people therapy sessions through a chat, but then there's an AI in between that reads the messages and then suggests that, okay, now he said this, you could suggest this kind of approach, or he's talking about sleeplessness, you could try one of these interventions, or they're talking about being self-destructive, now you have to send this information that please contact these places. So this is loosely based on what was published by Formulator in a white paper. And then if we look at the mental health in the workplace, then we come to the issue of psychosocial factors at work. So the factors that are causing stress, and this is what Johanna is probably going to talk about a little bit more. But there are a couple of kind of challenges in measuring these psychosocial factors. So one is that measurements usually happen in hindsight. So we asked that, have you been very busy last week, or have you felt stress, or have you had trouble sleeping lately? Another one is that the questionnaires and the surveys, primarily they tell us about the effect of the psychosocial factors. So we have questions like, does the cooperation between teams in your company work well? And that basically tells, I mean, it can be a psychosocial factor that it's not working well, but the reason why it's working well or not is not that obvious. Or this kind of question that we have in the service that we provide our clients with, that I usually manage my tasks within normal working hours. So this is a sign of stress, but this is not in such a psychosocial factor. Then a major problem, and this is something that I'm really eagerly looking forward to what kind of solutions are emerging in this area, is that measurements are basically based on experiences and opinions. We ask people that, do you feel stressed? We ask people that, do you have too much of a workload? We ask people that, are your goals clear or unclear? And what is related to this is that then we assume that every employee has an equal amount of self-awareness, so they kind of recognize that, okay, this is stressing me. They're able to reflect it, that I'm feeling stressed because of this, and that they are equally prepared and kind of eager to voice this criticism, to kind of raise the issues in the workplace in all situations. So if you have a company that is planning layoffs, and then you ask people that are you happy with the company, and are you feeling stressed, then I don't think everyone will answer those questions honestly. Okay. And then if we look at the thoughts like, what do I think that workplaces need to promote, protect, and support mental health? So I was talking about, like, what are the possible applications that you can recognize the problem, you can help pick a solution for the problem, you can implement the solution or you can support the solution. So what kind of issues do we need to kind of attend to, and how would AI help in this? So one quite obvious is the risk identification and management. So how do we best recognize the risks in the work, the psychosocial factors? How can we manage it, keep track of them, keep kind of following up that what is going on with this issue? Another one is that do we identify the resources that we have and can we manage them? So in this sense, resources means things that people are happy with, that help them to cope with the risks, that help them to cope with the work. So how do we identify what is working well, why is it working well, and how do we keep track of that and keep it working well? So this is one of the questions that I see that AI can help with. Then a bit more tricky one, reflection and shared understanding. So usually the problem is not that we don't recognize the risks or that we don't understand them. I think every one of us knows that too much workload with unclear goals and too little contact with other people is usually not a very good recipe for promoting either well-doing or well-being in the workplace. But we don't have the time to sit down and kind of reflect and get to know this. Now oh yeah, and then there's one more, and then a very important one, because it's kind of easy to build an application that you give some data to, and then it suggests that you should be doing this. But how do we get people to stay motivated? How do we keep the companies motivated to kind of maintain the good practices that help with the risks and also strengthen the resources? There's one Finnish startup that is working with this reflection and shared understanding called Icologist, which is kind of an interesting idea that their premise is that the AI works as a kind of consultant or agent within the organization, so it can listen to the employees and then it can make summaries and report back to the management and so on. And then it also helps the employees in chat related questions and so on. So there was one question that was posed before the webinar, and it asked that can AI replace psychologists? And so I was thinking about it, and I kind of tried to make a simple demonstration of that I think on the surface level you can get quite far. So if you think about reflection as a therapeutic method, reflection is when someone describes a problem with you, describes a problem to you, not with you, to you, and then you reflect it back, that is this what you were talking about, or this is what I picked up, or this is what I heard. And it seems that large language models work quite well with this. So there's a link to the complete chat with the prompt I used. This is the free access GPT 3.5 on chat GPT that I used, but the discussion went like this: that first I prompted it to be a coach, not a psychologist, but someone that is here to support me in my well-being in the workplace and how to assist me. So I posed a question that I feel stressed, and I had given the prompt that it should reflect back what I said. So then the discussion continues. It asks about the reasons. And then again, it reflects back what I was saying here, and then ask me that how am I coping with the stress, and I tell that I'm not coping very well. I keep procrastinating and putting things off to the next day, and then it starts explaining this. So I think that when we have an issue where you kind of can recognize what is going on, can verbalize what is going on, and need someone to kind of help you find a little bit other viewpoints, then surprisingly well the large language model seems to work with this. But if you want to look at the whole conversation, there's a link included in the presentation material. But then I think the biggest challenge here is, as with all kind of new technologies and new approaches, is that I don't see the biggest challenges in building the tools, as it As you can see here, this took me about 10 minutes to make. So some kind of trivial concept or low level tool is quite easy to make. But the main challenge is in maintaining the motivation to kind of implement this, that if this chatbot gives me some good advice on how to work with the stress, then that I keep motivated in starting those measures and doing them. And then the other one is that the companies are able to kind of allocate enough resources, and this usually means time to actually change things. Otherwise, we will end up in a situation where you kind of try to outsource the problem that people's or employees' mental health is being challenged, and then the solution is to kind of try to solve it outside the organization and outside the work environment, and without changing the work that we are doing. So this is how I see the needs of working life for AI based mental health support.